Health Check is presented by
Island Cancer Center.
A medical team from the Shriners Hospital for Children in Hawaii is back again on Guam to administer healthcare to the island's youth. Since 1989, the Shriners Hospital for Children has partnered with the Guam Department of Public Health and Social Services to provide free biannual consultative services for children up to 18 years of age. According to Margarita Gay, the Bureau of Family Health and Nursing Services Administrator, the medical team consists of an orthopedic doctor, a nurse practitioner, and other staff members. The team will primarily service patients with orthopedic problems such as diseases or injuries of their bones and joints.
The common, conditions that we see if you think your child may want to come in is some premature babies is one. They may have some problems with their legs and arms. Scoliosis is another one. If it's your doctor may tell you they have a disorder, a bone disorder, and that's one that they may come in. If they lose any of their fingers or any extremity, or then that's another one. If you had a major burn on the child's body that gives them limited mobility, then that's another issue that you can bring in. If you notice your child is walking funny, crooked, bow-legged is another condition they tend to come in with. And if your doctor has mentioned something relating to orthopedic issue with your child, then we're very welcome to have them seen by the doctors. They come here as a referral. They look at the child and they examine the area where they're having problems with their bones, and they would refer for further testing, like more x-rays or ultrasound, or they will prepare the child to get surgery to fix that area.
On average, the outreach clinic has been able to serve 300 to 400 children per visit. However, their service to the island's youth does not stop once they return to Hawaii, as the clinic offers telemedicine throughout the year and subsequent follow-ups.
They also provide post-op treatment, so they check them after they get the surgery, if it's a year after, if they're doing okay. So they provide medical services and then surgical at Honolulu, Hawaii. It's very beneficial. The partnership is number one, being having these doctors here, because we don't have that service here on Guam that much. We have limited, but just being here for the children that with their needs is the greatest thing they can do for us. And being our children are being served, and that's what we needed from them, and they are providing that service to us.
Parents are encouraged to schedule an appointment for their child, as the consultative services are free. The medical team will be working out of Central Public Health in Manila from July 28th to August 6th between the hours of 8 a.m. to 4 p.m.
They must come and see our social worker, Miss Cindy Manalam, in room 152 here in Manila Public Health between Monday to Friday from 1 to 5. They don't need a doctor's referral. They just need the parent to bring the child with their birth certificate, and the parents, whoever accompanies them, with their ID. And then they will fill out a form to be slotted schedule. So don't worry about ultrasound or prior authorization or doctor's referral. They don't need that. Just bring them in so we can set their appointment.
Currently, there are only 291 patients with confirmed appointments. For more information on the outreach clinic, contact DPHSS at 474-7351. With this week's Health Check, I'm Allison Chu.
Health Check is presented by
Island Cancer Center.